In his contribution to this debate, Paul Davies twice used the word draconian, and this is a draconian measure. We cannot pretend it's anything else. And I'm sure that most of us in this chamber will not be supporting it with a light heart. We would have loved to see our fellow citizens comply with what they were being asked and advised to do, but sadly we know there is a minority, and I believe it's a small minority of people, who are not prepared to take the very, very clear advice, and that means that powers must exist to protect the population from this unprecedented disease. We really don't know, as the Minister said earlier, what it's going to do and how it's going to affect us. And so Plaid Cymru will be with quite a heavy heart in many ways, supporting this legislative consent motion. In my contribution, Deputy Chair, I want to echo some of the concerns that have already been raised, particularly by Mick Anthony, not about whether the powers should exist, but how those powers might be used and how this place might be able to participate. Because as the Minister has said, the taking of these powers, some of these powers, does not necessarily mean the use of them. It may not be necessary, but there are some areas, and I'm sure many other members of the Senedd will have had representations, for example, from disabled people who are really concerned that if the requirements are hard-fought requirements, requirements that they've taken many years to campaign for, around the right to support, are removed, that they will lose care packages that would make them vulnerable. I'd argue would actually make them vulnerable to ending up in the hospital system, which of course would be the last thing we'd want. And the Minister will also be aware that there are concerns about the removal of some protections for mental health patients. Now, I know that this Welsh Government would not likely use those powers. But I do understand why the constituency have been writing to me and to many of us, and about the rights of disabled children to access education, all of those things, that those fears are real.